Epidemiologic Principles and Methods, Understanding How We Study Disease, based on Chapter 5 Introduction to Public Health by Mary-Jane Schneider. This educational video is based on Chapter 5, Epidemiologic Principles and Methods from the book Introduction to Public Health by Mary-Jane Schneider, published by Jones and Bartlett Learning. This content is presented for educational purposes in accordance with fair use for teaching and learning. Epidemiology is the science behind how we understand disease in human populations. It tells us not just what's happening, but why it's happening and how we can prevent it. In this video, we'll explore the foundational principles and methods of epidemiology. You'll learn how we define disease, measure its frequency, identify risk factors, and design studies that inform major public health actions, from vaccines to screening programs. What is epidemiology? Epidemiology is defined as the study of the distribution and determinants of disease frequency in human populations. This means we look at where disease occurs, who it affects, how often it happens, and what factors are associated with it. These patterns help us prevent disease before it spreads or worsens. Step 1. Defining the disease. The first crucial step in any epidemiologic investigation is clearly defining what exactly counts as a case. For some conditions, like death from a gunshot wound, the definition is relatively clear and easy to count. For others, like hepatitis, which has non-specific symptoms, or emerging illnesses such as eosinophilia myalgia syndrome, the criteria are more complex and may involve lab tests to verify a diagnosis. Epidemiologists also study health outcomes beyond just diseases. This can include injuries due to traffic accidents or even risk factors like high blood cholesterol, which are not diseases themselves but are significant to health outcomes. Measuring disease frequency, incidence, prevalence, and mortality. Once a health outcome is defined, we must measure how common it is by relating the number of cases to the size of the population at risk, yielding a rate. There are three primary ways to do this. Incidence is the rate of new cases of a disease in a defined population over a defined period of time. It tells us the probability that a healthy person in that population will develop the disease. Incidence is particularly useful in identifying the causes of a disease. Prevalence is the total number of cases existing in a defined population at a specific time. This helps us understand the overall burden of disease and is most useful in assessing the societal impact of a disease and planning for healthcare services. Finally, mortality rate or death rate refers to the incidence of death and is often used as a measure of frequency for diseases that are usually fatal. Descriptive epidemiology, where epidemiologists use descriptive data to understand the distribution of disease, which are the answers to the who, when, and where questions. Who is affected? This characterizes the disease victims by factors such as age, sex, race, occupation, and economic status. For example, the early AIDS epidemic identified its primary victims as gay men and intravenous drug abusers, leading to hypotheses about transmission. One looks for trends in disease frequency over time, seasonal patterns, long-term changes, and the elapsed time since a specific exposure. This is crucial for tracking infectious disease outbreaks, where epidemiologists construct epidemic curves by plotting cases over time, where explores geography, comparing disease rates between different countries, states, or even urban and rural populations. These patterns are critical for forming hypotheses. For instance, the hypothesis that fluoride protects against tooth decay arose from observing lower dental cavities in areas with naturally fluoridated water. Determinants of disease. Once we understand the who, when, and where, we then ask the crucial question, why? This information on disease distribution gives us clues about the determinants of disease. Epidemiologists often look for risk factors rather than single causes, especially for complex conditions. For example, smoking is a well-known risk factor for lung cancer. Studying these patterns helps us infer potential determinants and decide what to study next, guiding where we target public health interventions and policies. Types of epidemiologic studies. To formally test the hypotheses generated by descriptive epidemiology, epidemiologists use three major types of studies: intervention studies, cohort studies, and case control studies. Each design has its own strengths and limitations, depending on the research question being asked and offers different types of information. Intervention studies are the closest epidemiologists come to true experiments in human populations. Participants are typically randomized, meaning assigned by chance, to a treatment group which receives the intervention or a control group which does not. The most convincing intervention studies are randomized, double-blind, placebo-controlled trials where neither the patient nor the physician knows who is receiving the actual intervention versus a placebo. A classic example is the 1954 field trial of the Salk polio vaccine, which used a randomized, double-blind, placebo-controlled design with over 400,000 school children. This trial demonstrated that the vaccine significantly reduced polio incidence. The Physicians' Health Study is another example, which tested aspirin and beta-carotene, finding that aspirin significantly reduced heart attack risk while beta-carotene did not reduce cancer incidence. Cohort studies. When an intervention study isn't feasible or ethical, cohort studies provide the next best method. In a typical cohort study, a large group of healthy individuals are first questioned about their exposures, then followed over a period of time to see who develops the disease. The only difference from an intervention study is that people choose their own exposures. This method has revealed major findings. The Framingham Heart Study identified high blood pressure, cholesterol, and smoking as major heart disease risks. The Nurses' Health Study linked regular alcohol consumption to an increased breast cancer risk and studied oral contraceptives. The definitive studies on smoking and lung cancer were also cohort studies. Cohort studies measure the strength of association using relative risk, which is the ratio of the incidence rate for exposed persons to the incidence rate for unexposed persons. An RR greater than 1.0 indicates increased risk from exposure. Case control studies work in reverse compared to cohort studies. They begin with people who already have the disease, called cases, and compare them to a control group of similar healthy individuals. The goal is to identify differences in their past exposures. This method is much faster and cheaper than cohort studies, but is generally considered less accurate. Key examples include the Reye syndrome study, which found a strong association between aspirin use in children with a viral infection and the rare, deadly illness. A 2015 case control study in Brazil that linked maternal Zika virus infection to microcephaly in newborns, powerfully ruling out competing hypotheses like vaccines and chemical exposure. Case control studies estimate the strength of association between exposure and disease by calculating an odds ratio, relative risk versus odds ratio. While relative risk and odds ratio are both measures of association, they are not the same and are used in different study types. Relative risk is a ratio of probabilities, the ratio of the incidence rate for exposed persons to the incidence rate for unexposed persons. It's generally more intuitive. The odds ratio is a ratio of two ratios, the odds of exposure in cases versus controls. Fortunately, the odds ratio is an excellent approximation of relative risk when the disease has a low incidence, typically less than 10%. Both metrics help us quantify whether an exposure is associated with a disease and how strongly, which is crucial for deciding if public health action is needed. Conclusion: epidemiologic principles and methods help us move from simple observation to powerful public health action. We start by studying the distribution and determinants of disease frequency by person, place, and time. Then we explore associations and test hypotheses using rigorous study designs like intervention studies, cohort studies, and case control studies. The insights gained, whether it's proving a vaccine works, identifying a new risk factor, or understanding a disease outbreak, shape the policies, treatments, and strategies that protect population health. Epidemiology provides the essential evidence that drives public health forward. Attribution and call to action. This presentation draws on material from Introduction to Public Health, 6th edition, by Mary-Jane Schneider, published by Jones and Bartlett Learning. All rights remain with the original publisher. If you found this video helpful, please give it a like, subscribe for more public health content, and share it with your classmates or colleagues. And let us know in the comments. Which type of epidemiologic study do you find most important and why? Thank you for watching.